We start tonight with the final episode in a three-part series that you'll only see here on CBS 7. Our own Hannah Brock brings us the final report on Marathon Health Clinic's future.
Marathon Health Center is enduring the trials and tribulations necessary to finding grassroots rural healthcare solutions. Clinic staff say they hope that this center serves as a vessel to change attitudes about health in their community across the state of Texas and throughout the country.
It's been a long journey to bring telemed to Marathon, but the trek is far from over. Telemedicine is just a seed, an open door.
What my vision is people come for the basic care that, oh, we only use that when we need it, but then they come back for other things that the community can provide.
Health isn't just medical. It has elements of mental, physical, and social wellness. The clinic wants to prevent poor health in the first place.
Exercise, nutrition, even just getting together in a place that's not a bar. There is no indoor air-conditioned space in this town for people to gather socially.
Center staff apply that do-it-yourself style to any need they can find, like their community room that's open for gatherings, hosting clinics, creating room for teletherapy and grief counseling, and even offering a 24-hour gym for $15 a month.
And that's all working systemically with our community, from health from the roots up. Like, how do we make a healthy person?
They're also asking important questions and setting goals.
In your ideal world, money's no object, time is no object, what would your healthcare look like? We can't necessarily rise to those bars, but we can go as high as we want to with it. You know, we can try to get as close as we can to meet those needs.
It's that ambition that has made the center a trailblazer for rural healthcare.
We will have a template for other rural towns to be able to implement telemed fairly quickly without all of the frustrations that we've had for a couple of years. Being the first one out of the box, of course, we're figuring it out.
It's been a process of changing and fixing the telemed tools, coordinating appointments with Texas Tech doctors in Odessa, plus changing resident attitudes.
We know that there is interest in the services. It's more a question of getting ourselves to the point where we have consistent availability. We're open consistent hours. People feel comfortable popping in or calling.
The center has innovated so quickly that it's outgrown some of the latest telemed options. For example, they need software that helps to coordinate records between telehealth centers and providers.
Oddly enough, Marathon, our little town, we are waiting for the technology to catch up to us. We are way ahead.
While they may be forging the path, they're certainly not alone. Gallo says replicating an urban system isn't the answer.
I think that a lot of rural communities that lack healthcare services try to solve that problem by mimicking the healthcare services of larger communities.
She pointed to poor healthcare across the country. For example, the U.S. was ranked last among 11 high-income countries by the Commonwealth Fund, an independent research firm.
What I think small rural communities need is to play to their strengths. And the strengths of rural communities are that we are very interdependent and we tend to work together even if we don't hang out together. And we are very used to accessing every available resource and using it until we can't use it anymore.
It isn't just rural knowledge. The clinic also wants to find ways to improve the American health system as a whole.
I would like to give my best effort at developing an alternative to the larger systems that simply don't function.
She says the clinic might be able to get another health system to take them on, but they'd be limited by their specific services. That doesn't work for a community with so many unique needs.
It's kind of like Frankenhealth. We're piecing together all of these bits and pieces, discarding what doesn't work and keeping the things that do work. And when necessary, we're inventing solutions to problems that don't have a solution at this time.
That's why the freedom of their Texas Tech partnership works. The clinic can use skilled tourists who can provide medical support, plus work with other providers when the opportunity arises. Ultimately, Marathon residents still want and need a doctor.
For this community in particular, that are fairly hesitant to embrace technology, that they still want that one-on-one doctor.
Marathon is currently cutting through the red tape to accomplish that.
We have to be able to not only have a doctor's appointment for people, but if the community wants to use this as a yearly service, they have to be able to access things like blood work.
That specialty care still requires hours of driving. Telemed is just one way to conquer Marathon's complex needs, and going forward, the health center plans to keep trailblazing.
So we're really on the forefront and testing out technologies that are going to be applicable to everybody, and we're out here testing them. So I think, boy, hold on to your seat for the next 10 years.